Peace be to you all. AsSalama'laikum. This is Omar Abdul Malik, physician assistant slash associate and health educator. So, for those of you guys who don't know me, I've been in the healthcare field for a little over 30 years. I started as a certified nursing assistant, did that for 8 years, CNA 1990 to 1998, and then went to PA school, and I've been doing that since I've graduated in 2001, and I've got a doctorate in health education. So I was thinking about the current events that are going on in relation to healthcare, at least in the U.S., well, worldwide. So obviously the COVID-19 pandemic, but also the laws in certain states that are banning abortion during certain times during the embryonic slash fetal development. So I want to first say that I am grossly ignorant about some aspects of these things. But there's others, even the issues with the gender reassignment surgery and things like that. And I would definitely profess to abysmal ignorance about some of these things. However, I am a practitioner. I have been in the healthcare field for quite a while. I've worked for the last 6 years as a hospitalist, PA, in Washington, D.C. Before that, I was an outpatient. I did a lot of work in just preventative care, always with adults. Some of it was with HIV also. So, in some regards, I can speak with some degree of competency within the parameters of my profession and experience. Having said that, I've noticed what I feel to be an increasing degree of distrust of the healthcare community. And, you know, everybody has a voice now. I'm 53 years old. Yesterday was my birthday. So I've been around since before the internet, before you could become some type of healthcare person, whether it was a wellness advocate or something, or kind of create your own health and wellness position or industry. So I've been, and then start a YouTube channel and have possibly thousands, even millions of subscribers and make money that way to write some books. So I've been around since before that time, but now literally anybody can have a voice and have a very large platform on healthcare issues. And the larger their platform and the more vociferous, louder they are, the more they're able to sway public opinion. And this in turn affects politicians' decision making. So you end up with politicians determining what healthcare providers, degreed, certified, licensed healthcare providers can and cannot do. And that's not always for the best. Sometimes it's with good intentions, but sometimes it has highly deleterious effects. And if you don't follow certain algorithms or so forth, and you have disgruntled patients or family members, they want to sue because they didn't like the particular outcomes of your services. Now, when you have this, it's very difficult to fight. It really is. And I can tell you, speaking from more than 30 years of experience, whether it is a family member who's accusing you of negligence because you didn't change their mother's diapers or sheets, and they had a bowel movement, and they've been laying in their own waste all day long, which any CNA, either certified nursing assistant or patient care technician, would not allow. But it's very difficult when the family member of a patient in a nursing home or a hospital is accusing you of that. How do you defend yourself? It's hard. Or if you're a big shot surgeon at a big shot hospital, they get a bunch of money, like Dr. Stephen Strange from the Avengers, doing some type of neurosurgery, or in real life, Dr. Ben Carson, pediatric neurosurgeon, now retired. And people are coming after you and accusing you of things. He wrote about this in his book, Gifted Hands, many years ago. But it can be very vexing when the public no longer trusts or has an increasing distrust of the healthcare community, because sometimes it stymies. All right, you gotta stop. Sometimes it stymies how we're able to practice or care for our patients, because you're afraid. Okay, I can't do this. I don't want to mess up. And some people just leave. I've talked to doctors. They're like, I'm done. I'm out of the medical profession completely. I now just give lectures and write books. And like, how you doing? And that's what they've told me. These are MDs who we need. I've talked to nurses about nurse burnout, especially with this COVID-19 pandemic. A lot of people were congratulating our brave doctors and nurses in the beginning for being heroes, and now, in many regards, they're in some ways they're becoming a pariah. It's like, because some of them don't want to get vaccinated. Some of them have different views about the virus, or even if it's a view on controversial topics like maybe gender reassignment surgeries, especially for children. Different views about maybe abortion, this hot topic now. And when you're in an environment where you're afraid to speak out, afraid to do things for fear of losing your license, some of them are just like, look, forget it. I quit. I'm out. I'm not. I'll do something else. I'll become a librarian or something. Well, the libraries are closed. Maybe a park ranger. But I'd like to know what you guys think. Do you think that there is an increasing mistrust of the healthcare community, or has it always kind of been there? Or maybe I'm just too paranoid. You can tell me that respectfully if you're about being too paranoid. Our intention, at least when I finished school, we had to take the Hippocratic Oath, which is first, do no harm. And no clinician or healthcare practitioner intends to do harm. But sometimes accidents happen, especially if you're overworked. Or it's not always the case. There may be an accusation that's unfounded. But that's it for now. All of you guys that are either trying to get into PA school or just got in, feel free to reach out to me. I'll leave my contact information in the description. Check out the other channels that are health related and help you, whether they're nursing, whether you want to be a nurse or a doctor, PT, OT, RT. So many great professions in the healthcare field. It's a great field. I've enjoyed it. And for the most part, I feel very well appreciated by patients and their families in the public. You know, there are instances where I'm like, maybe I should become a writer like I wanted. That's it for now. Take care. Peace.